Thank you all for coming today. I'm Rebecca Teagarden, Communications Director at Virginia Mason Memorial Hospital. Behind me is our CEO, Carol Pete, our Chief Medical Officer, Marty Bergerman, and a host of professionals and doctors and healthcare professionals who care about our community. Everyone, Carol Pete, CEO.
Good morning. As Becky said, I'm Carol Pete, CEO and President of Virginia Mason Memorial. Our message today is a simple one. To save lives, we strongly urge the people of Yakima to go home and stay there. We have seen the COVID-19 projections for Yakima, and if we do not do anything now, we will have more critical patients than we can handle by April 8th, and people will die. Patients will die not just of COVID-19, but of other chronic illnesses because we will no longer have the equipment to treat them. Virginia Mason Memorial, along with our community partners, have been planning for this outbreak to reach our valley since the day COVID-19 hit Seattle. It is now here. We have worked closely with our partners at Virginia Mason in Seattle, and they and every hospital on the west side have been overwhelmed with those who need care. On Friday afternoon, we sought through channels to have Yakima County shut down at the state level, and that did not happen. So we are here now with a very strong message. We at Virginia Mason Memorial can no longer stand in line and wait for the wave of critical patients that will come. As Yakima's only remaining hospital, we must care for and about our community. No one is coming to save Yakima. Our message today is an urgent one. The only tool that we have to stop the spread of COVID-19 is to decrease contact. Please go home, stay home. Changing your behavior can save lives.
So I'm Dr. Marty Bergerman. I'm an emergency medicine physician here at Virginia Mason Memorial, and I serve as the Chief Medical Officer. We, the doctors of Virginia Mason Memorial, stand united before you today with an urgent message to our friends and our families in the Yakima Valley. We need your help to beat this pandemic. The COVID-19 pandemic has reached nearly every corner of the globe, and it is now here. On April, Virginia Mason Memorial and our community partners have proactively implemented measures to limit transmission, but these efforts cannot be enough. On April 8th, we physicians will be forced to decide which ones of our neighbors, our friends, or family members get a chance at life and which ones will certainly die. No one is coming to save Yakima. It is not too late, but the time is now. We can flatten the COVID-19 curve. Our projections show that even a 25% reduction in transmission will save hundreds, if not thousands, of lives here. Everyone needs to go home now. If we do this, we can make a difference. We can reduce COVID-19 in Yakima, but we cannot stop COVID-19. There is no vaccination. There is no treatment. We need you to help slow the spread of this disease. We call on all levels of government and everyone in our community to immediately shelter in place for the next 14 days. This means staying at home and not leaving except for life-sustaining activities. We know this comes with a huge economic and social burden. We know what we're asking of you. But we are here today to tell you this. We cannot protect and save Yakima without your help.
If anybody has any questions, you can talk to any of these professionals up here or any of our executive leaders. We'll be happy to pair you up. So please just let us know. Thank you again for coming.